Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Joseph Pepe. He's a physician executive. Today's Kevin MD article is A Doctor's Guide to Preparing for Your Death. Joseph, welcome to the show.
Thank you. Thank you very much, Kevin.
All right, let's start by briefly sharing your story and jumping into the Kevin MD article that you wrote for us today.
Sure. Well, my story is that I'm retired now. However, I felt like it's been a lifelong process of being what I like to say on all sides of the bed. When I was 17, I actually was in a car accident and fractured my neck. I was paralyzed from the neck down temporarily, but I learned a lot of lessons through that. And then I went on to school at college, and I was a biology major. And during that time, I also picked up a lot of ethics and moral values, which helped me later on in life as a
Hmm.
physician. So then I went on to attend Tufts University School of Medicine. And in the summers of college and medical school, I was a home health aide. I was an orderly in a nursing home. I was an OR technician. I was an orderly in a hospital. And so it got a lot of experience with all sides of the bed, so to speak.
Hmm.
And then eventually became an internist, practiced in New Hampshire, where you're
Hmm.
located now. And after a while, gradually got into healthcare administration. Became the senior vice president, and chief medical officer of a 330 bed hospital. And after that, eventually, reluctantly, I would say, became the CEO of that 330 bed hospital with 3,000 employees. During that time, I was on the board of many hospitals. I was even on the board of an insurance company. And I became a patient several times, two of which I had life-threatening illnesses myself. And then my wife got some very difficult news that she had a terminal illness.
Hmm.
I then became a caretaker as well. So when you look at all of this, you can see why I say that I feel like I've been on all sides of the bed. So now that I'm retired, I started doing some other things such as writing and giving back.
And your Kevin MD article talks about the doctor's guide to preparing for your death, and interested in hearing your perspectives from all sides of the bed on this topic. But for those who didn't get a chance to read your article, tell us what it's about.
Yes, it's about we need to prepare for our death. And it sounds morbid, but it really is a practical thing to do.
Mm.
People don't like to talk about it. And I think as clinicians, we need to get people to talk about it because 60% of adults do not have advanced directives, and only 31% even have a will. And so that leaves your loved ones scrambling. And what I've learned is that it's best to prepare so that they can grieve without having to go through all the chaos that surrounds documents and what needs to be done after someone passes. So it's things like coming up with a list, a checklist, and everyone's will be different because it's different based on who you are and your age and circumstances changes. But it's important to have that to-do list so that your loved ones can 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 be able to go to that list and get things like your passwords and all your digital financial aspects and all everything from websites to to everything, all your bank accounts, things that they will be scrambling for if it's not done. And so I think it's more than advanced directives. I like to say that people should be looking at estate planning.
Hmm.
And with estate planning, it's about revocable trusts. Anyone that has a nest that has a net worth over 250,000 should really consider revocable trust. But that deals really with the assets and distributions afterwards. But in that packet of estate planning, you would have living will or advanced directives. You would have healthcare proxy and or the medical power of attorney, so to speak, as well as a DPOA for financial reasons, HIPAA releases, all the things that your loved ones will need after you pass, and optionally, even a DNR status or POLST. And so it's very important to make your wishes known because it takes the pressure off your loved ones. And so the idea of the article was everyone wants to be like a turtle and put their head in and
Yeah.
their legs and arms in, but the situation is still there. You have to take care of it, and I do believe that it's difficult, but it's all about minimizing the overwhelming tasks that your loved ones will have to do when you pass on, and that's the best gift that you can give.
So when we're talking about the healthcare aspects of preparing for your death, you went through a lot of terms there: advanced directives, living wills, POLST. Go through some of these terms for those who may not be familiar with some of the nuanced differences between them all. So tell us about these terms, what they mean, and how they should be prioritized.
Sure. Well, for example, advanced directives will talk about your medical treatments, what your wishes would be, your preferences. And because so many times I've been at the bedside of a patient and the family's sitting around saying, I want to do what they would want, but I don't know what they would want. We never discussed this. They never wrote it down. And so that's what advanced directives are all about. It's really truly about what would your wishes be if should I become unable to tell you. And whereas something like a post or it's more of a physician order for treatment. And that is really that's about orders. And when I talk about post or orders like that or DNR, everyone has to go by their state because not all states will go by a post or a do not resuscitate order. So Florida is different than New Hampshire, which is different
Hmm.
than North Carolina. The advanced directives are about your wishes. DPOA, durable power of attorney, had to do with finances. HIPAA has to do with the ability of your loved ones to be able to talk to your doctors and obtain records so they can make informed decisions. It's all about making informed decisions. And the other thing that we don't talk about a lot is a revocable trust. That's one of those things. It doesn't have to do with medical treatment, but it does have to do with you're managing your money, your assets, managing the assets as well as distribution. It also helps your loved ones avoid probate, which will save them a lot. So this packet of estate planning is something we should be discussing with our patients. I think that we tend not to do that because there's so many things to talk about, but it's just as important as some of the things we talk about, meaning the stop smoking, the exercise, and all the other things that we educate patients on.
Now, what's the best way to introduce end of life wishes or planning in the exam room in the context of a primary care 15 to 20-minute visit?
Yes. Sometimes it has to be done in more than one visit, certainly. But I think the biggest obstacle is that people do not believe that they're going to have a sudden death.
Mm.
And what they don't know is that there's 320,000 unexpected sudden deaths a year in this country, of those between the ages of 20 and 64. So everyone thinks they're going to have time to do these things. So I start off by saying, you're healthy now, you're stable now. However, anything can happen, and it's certainly something that we should discuss because it's, if not for your sake, for your loved one's sake. And once they hear that it's not about themselves, it's about the people they love, they're more open, they're more receptive to listening to what we have to say.
Now, other than not planning for this at all, what do you see as some of the other big mistakes families make when it comes to end of life wishes and planning?
I think that some of the biggest mistakes that I've seen in my over 3 decade career is that I've seen families struggle with what a patient would want, but instead of really thinking about what the patient would want, they think of what they would want.
Hmm.
And it's a very common mistake. A daughter or a spouse would say, "I want this," but they're thinking about themselves, not in a selfish way, but that's how they that's just the thinking that they process they go through. And when what I do is I try to turn that on its head, and I said, "This isn't about you or about your brother or about your mother or about your son. This is about what do you think he or she would want?" And then right away, they have an answer. Sometimes they go, "Oh, they wouldn't want this," or "Oh, they would want X." And by reframing that question, I do believe we'll be able to help patients and their family better.
One of the things that you wrote in your article is shifting their mindset, right? From a fear of death to seeing preparation as an act of love, right?
Exactly. And I do think that there's a common theme where everyone wants to avoid talking about this. They think that if you talk about it, you're inviting it.
Hmm.
Well, we know that superstition is not logical, it's not scientific, but it's out there. And so it's trying to allow people to think seriously about this. And sometimes it seems overwhelming. So I tell them you need to break it down.
Hmm.
You really have to do one step at a time. Start small, and then set a date on your calendar, on your smartphone to say, "I'm going to start doing this." This isn't about perfection. This is about progress. The list that I have for my loved ones is much better now than it was 4 years ago.
Hmm.
And it should be updated every 6 months. But the first part is getting started.
Now, a lot of us in healthcare, sometimes new physicians, they don't get a lot of training in medical school and residency when it comes to talking about end of life care. Tell us what kind of tips you could share for physicians who may not be comfortable bringing it up in the exam room. What are some tips that you could share with us?
Well, some tips I can share is that it all starts with that ethical decision making. And I do think that's a huge lesson for all clinicians. If you, I used to have a statement that I lived by, and it helped me. And it was, if you do what's right by the patient, you'll always be right.
Hmm.
We can't predict outcomes. But if the intent is correct, if the intent is to what's best for the patient, not what's best for me, not what's best for my group or my hospital or my partner, but what's best for the patient, then any outcome that occurs, it almost doesn't matter in that you can sleep at night. You'll have no regrets. And I think people get lost. Clinicians get lost on decision making because they haven't ex they haven't been taught that. And so I know that you can have classes and courses on it, but I think that if you just take that statement, if you just do what's right, you'll always be right. I think that that would will help clinicians.
In a primary care practice, sometimes I find that there are cultural nuances when it comes to discussing end of life care, where some cultures may be more hesitant to talk about end of life wishes. How do you navigate some cultural barriers to discussing end of life care in the exam room?
That's a difficult one because there's a lot of different cultures in many cities, and our hospital happened to be in a city. And so a lot of it was self-learning. You would when you had to make when you had to do a discussion that involved something like this, you know when it's not landing. And when it's not landing, then you have to do your research. You have to find out what does it mean in this culture? And then you can take it the next time that comes around, you can take it from that. So I do think that I don't expect everyone. I certainly did not know every culture and how they thought of death and the dying process, but I do know this, that when I did not land the conversation, and you can tell when you don't land the conversation well, then you end up having to back up and do your research.
We're talking to Joseph Pepe, physician executive. Today's Kevin MD article is A Doctor's Guide to Preparing for Your Death. Joseph, let's end with some take-home messages that you want to leave with the Kevin MD audience.
The take-home message is just preparing for death isn't morbid. It's a gift. It's a gift to your loved ones. It frees them from the chaos and the guesswork and allows them to focus on what truly matters, the grieving, the remembering, and the healing process. So do your work now so your loved ones can live better later.
Joseph, as always, thank you so much for sharing your perspective and insight, and thanks again for coming on the show.
Thank you, Kevin. Thank you very much.